All right, good afternoon, everyone, and welcome to today's training on Introduction to PSYCKES. So just some housekeeping things before we get into the training. We will be using the Q&A feature via WebEx, so all phone lines are muted for today's training, but you may access the Q&A box in the WebEx menu at the bottom of your screen. If you click on the three horizontal dots and select the Q&A option, that should open up for you. You can also type these questions using the Q&A feature throughout today's webinar, and by default, that will be submitted to all panelists, so we can all view the questions that are submitted to the Q&A box. Please do not use the chat function, as it will not be monitored for any of the questions during today's webinar. So again, all questions can be submitted through the Q&A features, and those will be answered throughout today's webinar. We will also leave time at the end to address some questions on air. We also will have these slides and recording emailed to all of the attendees as well after the webinar, and the slides and the recording will also be posted on our public website. All right, so here is our agenda for today's webinar. We will be going over PSYCKES as well as instructions on logging into the application. We will then focus on setting up your PSYCKES user profile, followed by learning about different screens that we have in PSYCKES, and also accessing client level data that is available in our application. We will then end the webinar with details on additional PSYCKES training as well as some information on technical support. And then, of course, we will be reserving some time for questions and answers. So let's begin with a quick overview on PSYCKES. So what is PSYCKES? PSYCKES stands for the Psychiatric Clinical Knowledge Enhancement System. It is a secure and HIPAA-compliant online application for sharing Medicaid claims and encounter data and data from other state administrative databases. This application is designed to support data-driven clinical decision-making, care coordination, and quality improvement, and we will go into more detail about how to do that with reports within PSYCKES. In PSYCKES, we do have ongoing data updates. So the data in the clinical summary is updated on a weekly basis, and then the quality indicator reports are updated on a monthly basis. And for all these different features that we have in PSYCKES, we will be going over in much detail. So who is viewable in PSYCKES? We do currently have over 12 million individuals viewable in PSYCKES, and it includes individuals with any history of Medicaid-funded behavioral health diagnoses or treatment, or state psychiatric center inpatient or outpatient services, or health home outreach or enrollment. So if a recipient falls within this population, we will provide all data. We also have data regarding general medical health, behavioral health, residential, lab, pathology, and many other types. So more about what data is available in PSYCKES. We have the clinical summary, and this will provide up to 5 years of data. As mentioned previously, this is updated on a weekly basis, and this includes all Medicaid fee-for-service claims, managed care encounter data across many different treatment settings. We also have medications, medical and behavioral health outpatient and inpatient services, crisis care coordination, among other. We also pull data from multiple other state administrative databases listed below. And for these, we do have a very quick turnaround. So there is only a 0 to 7 day lag with these data sources. We have data coming in from the New York City Correctional Health Services, New York City Department of Homeless Services, DOH MAP, Managed Care Plan, and HARP status coming in from the MC enrollment table. We have the state PCEMR, OMH TACT, OMH CARES, NIMERS, New York City Department of Health and Mental Hygiene, as well as documents uploaded by providers such as the safety plans and screening and assessments in PSYCKES My Choice. So all of this data that we previously discussed is available in different types of reports in PSYCKES. We have the individual level client reports, and that is the clinical summary. Again, that's Medicaid and the state databases, treatment history, and that provides up to 5 years worth of data. We also have the provider level reports, and there are four different types of provider level reports. We have the MyQI report, and that will display current performance on all of the quality indicators. So within these QI reports, you can view the names of the clients who are flagged. If you are a provider level user, you would enable access to get information for that specific recipient. Similarly, for recipient search, you can run ad hoc reports to identify cohorts of interest. You can also look at a list of recipients in different advanced views, which will show you different information that you may be interested in. If you are a provider level, if you have provider level access, this is where access would need to be enabled to be able to view the clinical summary information from there. Next, we have the usage reports. So usage reports are helpful as they are used to monitor PHI access by staff. So you can go into the usage report and see who is viewing the clinical summaries for specific recipients. We can also see who is enabling access and by which type. So if access was enabled by a provider user via emergency attestation, or if a client consent was entered, that is something that you can view in the usage reports. We then have the utilization reports, and this is to support providers that have value-based payment data needs. And lastly, we have statewide reports, and these are very similar to my QI report. So throughout statewide reports, you can look up a quality indicator and review statewide proportions by provider location, region, county, client residence, region and county, plan, network, and provider. And these are at the aggregate level. So now switching gears to quality indicators. So what are quality indicators, also known as quality flags? So, OMH has identified a number of health conditions or treatment issues that are quite important. And what PSYCKES does is that it tracks clients who are positive for one or more of these health conditions or treatment issues. This way, the provider, the managed care plan, local county, or state government leadership can be made aware and take necessary steps. These flags can assist with supporting clinical review as well as quality improvement. The other thing we do regarding quality indicators is we roll up the information as aggregate data in order to provide prevalence rates at program level, at the agency level, managed care plan by region or state. And so users can look at the prevalence rates and see where there are opportunities for improvement. Here we have some examples of our quality indicators, such as the no diabetes monitoring for individuals with diabetes and schizophrenia, low medication adherence for individuals with schizophrenia, high utilization of patient or emergency room services, and eligible for Health Home Plus service in the past 3 months or 12 months. We also have our performance tracking indicators coming from the New York State Department of Health, and these include many of the substance use disorder quality measures. So while the PSYCKES quality improvement reports is updated on a monthly basis, DOH calculates these performance tracking indicator sets after a 6+ month billing date maturation period to allow for service invoicing. So the as of date for these measures in the application reflects the most recent performance tracking data run by DOH. And these measures are based on a 12-month period of services. So currently we have over 33,000 active PSYCKES users spread across these following settings. So we have users from state psychiatric centers, freestanding mental health clinics, hospital inpatient units, ER, CPAP, and hospital clinics, OMH residential programs, health home and care management programs, assertive community treatment, personalized recovery oriented services, home and community based services, federally qualified health centers, OASAS providers, local government units, correctional health services, Medicaid managed care organizations, state agencies, the DSRIP performing provider systems, as well as the behavioral health care collaborative. So that was an overview on PSYCKES. Now let's discuss how users can gain access to our PSYCKES Medicaid application. So after an organization gains access to PSYCKES, the CEO or the executive director receives an email with the Security Management System Self-Registration, the SMSSR link. The CEO or the executive director will then need to forward this email to any staff that will be assigned the security manager role. So the security manager is the person responsible for locally managing PSYCKES access for other staff at your agency. After the SMSSR online registration is completed by the security manager, they will gain access to the New York State OMH Security Management System, also known as SMS. This portal is a separate OMH application used for locally managing staff access to OMH applications such as PSYCKES Medicaid. After the creation of the user's PSYCKES account by the security manager, users will receive an email with their user ID and instructions on installing a token. The token generates unique passcodes, which are required to log in to PSYCKES. So, to create new users, the security manager will log into the New York State OMH Authorized Management System portal, also known as AMS, and they will use the same credential used to log into the SMS portal. So, in this AMS portal, they will search a user with user ID or email and click sync. Users will be created in the databases with same user ID which you use from the SVCAD. And this is the step that must be completed in AMS when creating new users. Once that is complete, the security manager will log into the New York State SMS portal and search for the user with the user ID. And in order to edit their information, the security manager can click on this pencil icon located next to their user ID. And this will open a form where you can enter users' information such as name, email, as well as assign a token right here. And one thing to remember is that when granting PSYCKES access, the security manager must make sure that they check off this PSYCKES Medicaid box. Because if this box is not checked off, that means the user will not be able to gain access to PSYCKES. So that is another thing to double check in order to grant access to the users. So once your token request has been completed and the RSA Authenticator app is on your mobile device, you will be ready to activate the token and install the token on your mobile device. For this step to be completed, you will need a desktop computer to view the self-service console, and make sure to have your mobile device close by for the token installation process. An important reminder, you will need to download the RSA Authenticator app from the App Store or Google Play Store onto your mobile device prior to installing your token. So please make sure that it is the correct app, and we do have the logo of the app located right here on the right side of the screen. So after your security manager has provided you access to PSYCKES in SMS, you will receive an email with a self-service console link as well as your user ID and a temporary password. Once you have these information, you will then need to log into the self-service console. And as you scroll towards the bottom, you will see this login box where you will enter the user ID that was provided in the email. And as for the authentication method after you enter your user ID, you can select the password option if you have been issued a temporary password by the OMH help desk. So in this password section, you will then enter the temporary password that was included in the self-service console or the token email, and the temporary password is included in the same email that had your user ID. So once you enter the temporary password provided by the OMH Help Desk, it will prompt you to create a new password, and your new password must be between 8 and 32 characters long, and it must also contain one alphabetic character and one special character. So once you created a new password and you are able to log into the self-service console, under My Authenticator section, you can select the Request a New Token option, and this will open up a new screen where you can request a hardware token, which is a physical key fob, or a software token, which you will be installing in your mobile device. So in this instance, you can select the software token. And once you have indicated that you would like a software token, you also have to specify which type of mobile device you currently have, and the token will then be installed on that specific mobile device. So once you have made your selection, you must come towards the bottom of the screen where you will be creating the PIN. So this PIN is important as you must enter it in the RSA Authenticator app to receive the passcode, which will be used in the PSYCKES login portal. And please make note of the PIN requirements we have here. So your PIN cannot begin with a 0, it cannot have sequential or consecutive numbers, and it cannot repeat any previous PINs. Once you have created your PIN, you can also put in a reason for token requests. If you are looking for access to PSYCKES, you can simply mention that, or if you have received a new mobile phone, you can also mention that as well. So once all of these required fields are completed, you can select Submit. And once your token has been approved, you will then receive an approval email from ITS, and that email will also include instructions on activating your token. So once you have received your token approval email, you need to log back into the self-service console, and you can select Activate Your Token under the My Authenticators section. So when you select the Activate Your Token link, it will pop up the screen where it will show you a QR code. You can scan this QR code with your mobile device's RSA app, and please note that this QR code is only valid for 5 minutes. So once you have your RSA Authenticator app installed, it will give you a place where you can scan this QR code, and it is only valid for 5 minutes. So once you have scanned the QR code, you will also get a confirmation screen on your mobile's RSA app. So once you get a confirmation, it will finally be able to be imported and your token has been successfully installed. So that was the process for installing a software token on your mobile device. If the security manager chose a hard token, which is a physical key fob, you will receive 2 emails from enterprise.rsa.prod at its.ny.gov. So the first email will state that a hard token request has been submitted, and the second email will state that the hard token request is approved, and it will include details to activate it. So once you have received the physical hard token, please make sure to verify the serial number in the second email, and make sure that it matches with the 9-digit serial number located on the back of the physical token. And please do note that hard tokens are sent to the organization's address on file, so please make sure that you have that information coordinated with your security manager. And if you misplace a token or deleted the hard token emails, or the number on the back of the hard token does not match the serial number listed in the email, you can simply notify the appropriate help desk. And we do have the email for OMH Help Desk located right here. So it's healthhelp@its.ny.gov. So in the hardware token email that you received, it will contain your user ID, and it will also include this enablement code as well as a serial number, and you will need this information to activate your hard token. So after you receive this approval email, you need to log back into the self-service console, and you can enter your user ID, the enablement code, as well as the token serial number in these designated boxes. And after successfully enabling your hard token, you'll receive a message stating that your token is now ready to use. So to summarize, if you are using a hard token, you will enter your PIN and the 6 numbers on the token all directly into the passcode box of the PSYCKES login screen. And if you are using the software mobile token, you will enter your PIN into the RSA Authenticator app, and then you will click Submit. And once you click Submit, it will generate these unique passcode, which will be used in the PSYCKES login screen. So those are the instructions on installing your token. And once you have your token installed and the process is fully complete, in order to log into PSYCKES, you can visit our PSYCKES homepage, which is www.psyches.org, and you can click on Log into PSYCKES, which will show this blue button, which will take you to our login portal. So in this sign-in selection page, please make sure that you are selecting the correct portal. So if you are a non-state employee, you will select the external/local provider portal. And you will then need to enter your PSYCKES user ID in this username box. And then you will also enter the passcode generated by your mobile RSA app, or if you have the hard token, you will enter your PIN and the numbers from the hard token. So these were the instructions on logging into PSYCKES. If you are logging into PSYCKES for the first time, you will need to complete the user role profile. And this informs our PSYCKES team about our users and such as roles within your organization, setting or program type in which you regularly work, any professional discipline or training. So you should update the user role profile if any rule or setting changes have occurred. Additionally, you will be prompted to update your user role profile once a year. If there are no changes, you can simply save the current information you have. So far, we have discussed what the PSYCKES application is and instructions on logging into PSYCKES. So now that you have access to PSYCKES, we will focus on different features we have available in this application. So here we have a list of different tabs in PSYCKES, and in the section, we'll be covering them extensively. So we have our quality indicator report, our statewide report, recipient search, provider search, registrar menu, usage reports, and utilization reports. We also have My Choice tab, which is available upon request. All right, so let's get started with My QI report screen in PSYCKES. So the MyQI report is a tool for managing quality improvement efforts. So when you log into PSYCKES, you will find 2 separate tabs for quality improvement measures and performance tracking measures. Again, the QI report is updated monthly, and within the report, we have the eligible population, which will be the denominator. And that is the clients that are served plus other parameters depending on quality indicator specifications. We also will display the number of QI flag, and that will be the numerator. I would like to make a note that each quality indicator measures have their own specifications, and these can differ from flag to flag. So it's really important to refer to our technical specifications document, which can be found on our PSYCKES website. So going back to our numerator specification, these identify clients who meet criteria for that specific flag. We also compare prevalence rates for provider agency, region, and state. You can also filter the QI report by program type, client residence, or provider location regions, or county. You also have the ability to drill into a list of recipients who meet the criteria for a flag. We have a race and ethnicity view of MyQI reports, which we will take a look at in the next few minutes. And you can also export these reports to Excel file as well as a PDF file. So my QI report will have attributing clients based on a couple of different things. So the first one is billing. Clients are linked to a provider agency if they have been billed by the agency in the past 9 months. We also pull information from DOH MAP, Health Home, and Care Management Agency databases. So, clients that are linked to a provider agency, if they are enrolled in a health home or a CMA according to MAP, will also be linked to QI reports. And then this rule is used to automatically link clients to providers so that current clients are included in the report each month. The period of observation for the quality indicator does depend on which measures you are looking at, so it will vary for each of these measures. For example, we have the period of observation for the high utilization quality indicator at 13 months, so that is a 13-month look back for that specific measure. So this is what the MyQI report looks like in the application. We have the QI report broken down into two different sections. So on the left, you will see the quality improvement as of December 1st, 2025. And these measures are considered more real time and they are run on a monthly basis. And you will see that we have noted here as well in the actual report. And then on the right, we have our performance tracking measures. And these are run with an intentional lag of 6 or more months. And this is to allow for complete data to be shown in the application. These are not run by PSYCKES, but rather run by DOH. And these are taken from measures from NCQA and HEDIS. So these are not PSYCKES dependent necessarily, but we do get that information from DOH, and that is put into the PSYCKES application. I would also like to point out over to our hover text. So when you hover over a particular indicator, it will provide you with its definition. And within QI reports, you can also apply different filters when you are viewing these measures. So here we have our filter options available. So you can filter by site, program type, managed care, MC product line, age group, population. If you want to search for all individuals or individual with complex needs, you can also filter by client residence, so client region and client county. Similarly, you can also filter by provider location as well as provider county. And for this specific demonstration, we have the New York City option selected for client region and the Bronx selected for client county. So this is the screen after you complete the search. Over here at the top, you can see the list of all of the filters that we have selected previously. And in this instance, we have New York City for client region and the Bronx for client county. And then on the top right corner of the screen, you can also see our export option. So you can export this file into a PDF format as well as an Excel format. So coming down to the quality indicators table, we have these indicators. We have the population included, and then we have our eligible population slash episode. And this population will be the denominator. And then we have the number of, or number with QI flag. So these are the number of clients who actually meet the criteria, and that would be specified in the specific column. And here you can also see the comparison of the region and statewide percentage. And then we also have these percentages displayed in a graph format. So for this demonstration, we have selected high utilization inpatient slash ER for our indicator set, and we will be selecting 2 plus inpatient slash 2 plus ER summary for a specific indicator. So once you have a specific indicator selected within one of the indicator sets, it will open up several other tabs in your my QI report screen, and one of the tabs is this Recipients tab, and this will show you the unique number of recipients. This is unduplicated, so each recipient will be listed, and this information currently is de-identified, so if the information is unde-identified, you will be able to see their name, their Medicaid ID, date of birth. We also have a column for race and ethnicity, quality flags, and a column for current PHI access. So as you can see, for these clients, consent has not been enabled. So currently you are seeing this enable access option. Once consent is obtained and enabled in PSYCKES, the recipient's name is going to show up in a blue hyperlink, and you will then be able to drill into the client's clinical summary. Aside from the Recipients tab, we also have different tabs that provide a variety of information. For example, if you select our new QI flag or dropped flag, you can identify clients who were newly added to your quality improvement list or identify clients who no longer meet the quality measure criteria for your agency. So for these two tabs, you can take a look at the information from the past 1 month or 3 months. We also have different recipients tab. For example, if your facility has multiple locations and you would like to generate a list of recipients based on those specific sites, you can select the site's recipients tab. If you would like to generate reports based on managed care organization, you can select the MCO recipients tab. Similarly, if you'd like information on recipients of specific attendings, you can also select this attending recipients tab. So when you select the standard view, and the previous screenshots were focusing on the standard view, it will display quality indicator prevalence rate for the organization compared to the region and statewide prevalence rates. In this instance, you can also select and change the view to race and ethnicity. So if you select the race and ethnicity view, it will display quality indicator prevalence rates for clients in different race and ethnicity groups. So the race and ethnicity view displays the percentage and the number of clients flagged for each of the quality indicators. And again, this is broken out by different race and ethnicity groups. And Medicaid data is the source of this information. So when the race and ethnicity view is applied, it is applied to both the numerator and denominator, and a percentage is calculated. And you can see clients who identified more than one race in their Medicaid registration will be represented by the multiracial group, and clients who identified as Hispanic or Latinx as their ethnicity are represented in the Hispanic or Latinx group only. And then for clients where race was unknown on their Medicaid billing, they are still included in this total report, but they will not be represented in one of these unique breakdowns. So when you take a look at these specific indicators, you can see the breakdown listed here, and it's good to note that the percentage that is calculated. So you can also export these information in a PDF or an Excel file. So as mentioned previously, the quality improvement measures are updated on a monthly basis. And in my QI reports, it will show you the data for the most recent month. However, if you'd like to view the previous month's data, you will need to utilize our QI Trends Past Year feature. So from my QI report dropdown, you can select QI Trends Past Year option. And in the next screen, you can select the indicator set as well as any specific indicator. You can also apply any of these applicable filters. And looking at this table at the bottom of the screen, you are able to see this historical data. So we have the state column, and then we have the eligible population, number with QI flag, your organization's percentage, the region percentage, as well as the state percent. So while the QI report is going to show you the most recent information, if you come to the QI Trends Past Year report, you will be able to find the information for the previous months. And at the bottom, you can also customize this view as well as save that particular view. And taking a look at on the right side of the screen, you can also export this information in an image or a PDF document as well as a PowerPoint. So moving on to our statewide reports feature. So the statewide reports provide users with a color-coded New York State map and a tabular report that highlights variations in prevalence rates for a selected quality indicator. Quality indicator information is available at the region, county, network, provider, and managed care plan level. So to use statewide reports, you can click on the Statewide Reports tab of the PSYCKES menu header, and the screen will display all these filters listed right here. So please do note that this indicator set field is a mandatory field, and then you can also filter by indicator type, program type, managed care, MC product line, age group, population, client resident, so client region and client county, as well as provider location. So we have provider region as well as provider county. And towards the bottom of the screen, we also have this indicator definitions link, and this is going to take you to a PDF document that lists out all of our PSYCKES quality flag definitions. So this is an example of our PSYCKES quality flag definitions PDF. So when you select that link, it will open this PDF and you can print this document as well as save them for a future reference. So once you apply the filters, you will be able to see a map of New York State, which provides a visual representation of the percentage of clients being flagged for a selected quality indicator, organized by provider county or provider location. And hovering the mouse over any of these counties, it will have a small box that will appear providing details about each county. And in the section below, the map provides information on selected quality indicators in a table format. So users will see these 7 tabs. So we have client region, client county, provider region, provider county, network, provider, and plan. So for each tab, the data pertaining to the state will always be displayed at the very top right here, and then followed by data pertaining to each of the tabs below. So that is a quick summary of our statewide feature that we have. And I also want to point out that it is updated on a monthly basis. So you can always refer to this as of date we have posted right here. And again, you can export these information in a PDF as well as an Excel format. So those were our information on the quality indicator reports to MyQI report and statewide reports. Now let's shift gears to one of our most utilized tabs that we have in our PSYCKES application. So our recipient search allows you to identify a cohort of recipients who meet search criteria or perform a search to find a specific recipient in PSYCKES. So for example, if an agency would like to identify all recipients who are flagged for a particular quality flag and have received services in a specific service setting, you can use recipient search to generate a list of recipients who meet that search criteria. And other examples of specific criteria that we have in recipient search are characteristics, special populations, quality flags, social determinants of health, service settings. So we have categories by specific provider or any provider. And we also have a section for medications and diagnoses. So our recipient search is divided into 2 tabs. So we have the individual search and then we have our cohort search. And you can also select if you'd like to complete the search based on a full database or if you'd like to limit the results just to your organizations. And in our individual search, you can search by Medicaid ID as well as the first name, last name, and date of birth of the client. If you are using the name and date of birth field, please do note that for our first name, first 2 characters are required if entered, whereas for last name, full last name is required if entered. So you could also narrow the scope of your results by using the characteristics section, which is updated on the weekly basis as indicated by this as of date. So before we move to our cohort search, I do want to point out the and or search logic built into our cohort search. So multiple selections within the same filter box creates an or logic, and you can use the control key on your keyboard to make multiple selections. Then recipients in search results will have one selection or the other. For example, depression or schizophrenia. And then multiple selections from separate filter boxes creates and logic. So recipients in search results meet all of the selected criteria, for example, schizophrenia and type 1 diabetes. So this is an image of our cohort search tab. Again, you can search by characteristics, you can search by special population, we have managed care plan and Medicaid. You can also search by social determinants of health. You have these SDOH categories, and when you click on this gray box right here, it will expand the subcategories for that specific SDOH category. And then at the top of the section, we have this limit number of results section, and by default, it is set to 50 recipients. However, if you would like to expand your recipients list, you can select this drop-down option. For example, let's say if you'd like to be shown 1,000 recipients or 10,000 recipients or even higher, you can come to this field right here and you have all those options available in this drop down. As you scroll towards the middle of the recipient search screen, you will see a section for our quality flag, and you can select up to 4 flags per search, and you can use your control key on your keyboard to make multiple selections. And we also have a link to our quality flags added right here. So scrolling towards the bottom of the screen, we do have a section for services specific provider. So you can search for groups of recipients through their use of specific services provided by your organization. So you can filter by region, you can filter by provider county, current access level, service settings, as well as number of visits. Similar to the SDOH section, you can select this gray box next to the name of the category to view all of the subcategories. Here we have a similar section to the previous slide. However, this one is services by any provider. So you can search for groups of recipients from your organization that are also utilizing services by other providers. So in this section, you have the option to filter by providers along with region, provider county, service setting, as well as number of visits. We also have a section for medication and diagnoses, and here you can search for groups of recipients through their medication and diagnoses information. So if you are searching recipients currently on a specific drug, I do want to point out that when searching by a specific drug name, in the medication and diagnosis box category, you can check off the active drug box next to the search for recipients currently taking that medication. You can also check the active medication past 3 months requiring prior authorization box as well. So here's an example of a completed recipient search. So at the top of the screen, you can see all the different filters that we have selected. So for quality flags, we selected 2 plus ER behavioral health or 2 plus ER medical. So in this instance, it is applying the or logic because we are selecting quality flags from the same section. And then we also have filters associated with specific provider as well as social determinants of health condition. And for these, because the selections were made in a different section, it is showing up in this and option. So after we have completed our search for after we have applied our filter. You can also export the information in a PDF format as well as an Excel format. And coming down to our column right here, so we have a column for name, Medicaid ID, date of birth, race and ethnicity, Medicaid managed care plan, Medicaid quality flags. We also have this planning and considerations column, as well as the current PHI access. So right now, for this specific example, the current PHI access says no access, and you have an option for enable access. And the name of the client does not appear in a hyperlink. So if you were to come here and enable access, the client's name is going to show up in a blue hyperlink, and you will be able to drill in to that client's clinical summary. So that was our recipients list based on a standard view. However, we do have other advanced views that you can search by. So we have our standard results view, which will include columns like quality flags and planning considerations, whereas care coordination, it's going to include all these additional information such as HARP status, MC product line, core eligible, AOT status, and then for high need and high risk, we also have these additional tables listed. So we have OMH unsuccessful discharge, AOT expiration date, suicide risk, overdose risk, as well as PSYCKES registries. We also have a view for hospital utilization. So it's going to include columns for numbers of hospitalization and past year broken down by ER, and inpatient and behavioral health and medical. And then we also have a view for outpatient providers. So that is going to include columns such as primary care physician assignment, mental health outpatient provider, medical outpatient provider, substance use outpatient provider, and all these different columns. So you can come to our view section located on the top right of the screen and change the view depending on which columns you would like to be displayed. So here's an example of our recipient search result where consent is entered. So taking a look at our current PHI access, it shows PSYCKES consent, and the client's name does show up in a blue hyperlink. So when you click on this link, it will take you to the client's clinical summary. Another thing that I do like to point out is a feature that we recently added, and it's regarding this planning considerations column. And this is a really helpful column that will show information such as notifications. So it will let you know that this client has complex needs, high mental health need. It will also tell you information regarding some of the documents that have been uploaded in this client's clinical summary. So for this particular example, we have care plans, discharge plan documents, psychiatric advance directive, relapse prevention plan, as well as any safety plans. And in this instance, you are able to view this information without consent. However, without consent, you will not be able to drill into the client's clinical summary and view the information in detail. So you will be able to see this information in our planning consideration columns, but if you'd like to drill into the specifics of it, you will need to enable access. So that was the information on our recipient search. Now shifting gears to our provider search. And here is our screen for our provider search tab. And in this instance, if you'd like to select a specific provider, you can always filter based on the region as well as the county. However, if you'd like to complete an alphabetical search, we do have an option here for that as well. So taking an example, if you select the letter A, it's going to give you a list of all the providers whose name starts with an A. So for our providers, you can also search for specific providers using this particular tab. So now that we have mentioned our PSYCKES consent and how you are able to view that information in our recipient search, we will shift our gears towards our registrar menu, and this is where you will be managing all these PSYCKES access. So when you go to our registrar menu, when you select this drop down, it will give you an option for manage PHI access, and it's going to take you to this screen where there's a section for enable PHI access. So if you would like to enter consent, you can simply go to the search and enable access and enter the client's Medicaid ID or first, last name, and date of birth, and you can enable access through there as well. And then you can also print our consent form. So it's available in English and Spanish, as well as 10 different languages. And our consent form is also available on our public website. Then we also have the section for provider detail for consent form. So if you fill out our consent form directly from our PSYCKES public website, it's not going to have any information regarding your organization. But if you would like that consent form to show the name of your organization as well as any details associated with your agency, you can come to this provider details for consent form section and select add/edit details. And once you have that information filled out, this consent form is going to be specific to your agency. We also have a section for consent withdrawal, and we do have the withdrawal of consent form located here, so English, Spanish, as well as in other different languages. And this is where you will come in to withdraw client consent. And then you can also deactivate attestation of services using this registrar menu that we have in PSYCKES. So moving to our usage report. So previously, the registrar menu was more focused on client level information and managing clients' PHI access. Usage report is more focused on PSYCKES user of your organization. So taking a look at this particular example, so when you select this usage dropdown, we have these three options. So we have PSYCKES user, and the first one, when you select this option, you can fill out the information, and when you click submit, it's going to give you a list of every single PSYCKES for your organization. So you can change the date range. You can also change the graph interval if you'd like to search based on roles in the organization or any of these other filters. You can apply that as well and click submit. So when you select this PSYCKES user option, it's going to give you a list of all the PSYCKES user that you have in your organization. Coming down to our PHI access module, when you select this option, it's going to give you a list of all the staff members at your organization that enabled consent for a client in PSYCKES. Lastly, we also have this clinical summaries option. And when you select this option, you can take a look at the members at your organization that have access to PSYCKES who viewed the clinical summary of a client. So you can keep it as broad if you'd like. So if you want to keep the date range as is and click submit, it's going to give you a list of every single staff members who viewed a client's clinical summary. However, if you'd like to search by a specific user ID or if you'd like to search by a specific Medicaid ID, you can also apply those information here and click submit. So taking a look at this particular example, we have entered the date range, and the information that we're seeing is regarding the usage during this time frame. And then it's going to show you these two numbers. So the first one that we have is unduplicated clients clinical summaries viewed, and then unduplicated users who accessed clinical summaries right here. And then towards the bottom, this is where the information is a lot more detailed. So when you take a look at this column, you will have your client name and their Medicaid ID. And then you'll also have the username. So this is the user who viewed this client's clinical summary in PSYCKES. And then we have the user ID, the staff member's role in organization, settings and program. And as you scroll, towards the right side of the table, you'll also get this information on clinical summary access history during reporting period. So you'll have the client name, their Medicaid ID, and then the first access by user. So taking a look at this particular example, it looks like the clinical summary was accessed on July 25, 2025, and the most recent was also that one date. And then currently the access level in effect shows no access. So this could indicate that consent was entered, but it may have been withdrawn at some point. Another example is this one where we have a client name, their Medicaid ID, when it was first accessed by the user, and it seems like the consent was entered. And here we have the most recent access by the user, and the access level in effect still shows all data dash consent. So it looks like consent is still available and it has not been withdrawn, unlike this particular example. So here's an example of the clinical summaries option that we have in our usage reports. And this is a great tool to kind of monitor how many staff members are viewing the client's clinical summary and how many users have enabled consent in PSYCKES for a client. So shifting gears to our utilization reports. So the utilization reports support provider value-based payment and behavioral healthcare collaborative data needs by enabling users to understand their Medicaid behavioral health population who have had services with them and other providers in the past year. So here's an example of our utilization report. So the first tab that we have available here is the Medicaid Managed Care Plan and product line tab. And this allows you to view the managed care plans and product lines that your client are enrolled in order to help inform which plans and product line to focus on. So this report includes a list of all of the plans that your agency's client are currently enrolled in. And the report also provides a summary of unique clients from the past year that are in any Medicaid managed care plan, Medicaid fee for service, and all client total. And it is updated on a weekly basis, so you can also view which managed care plan they have the most clients with to inform engagement and outreach. And the another tab that we have is this provider network report, and it displays a list of all providers that have also served your agency's current clients and the total number of those clients. So the first column here is the provider name, and it lists the providers who have served your agency's current clients in the report timeframe. And then the remaining columns here are labeled with specific service settings, and the numbers in the table represent the client number of clients who received a service from that specific service setting in a given column from this specific provider agency in this given row. So that is an example of our provider network view in the utilization reports. And then lastly, the service settings and volume reports. It displays the volume and type of Medicaid services provided by your agency and any agency to the clients you serve. The report displays the number of total unduplicated clients that have had a particular type of service in the past year and the total number of claims and encounters by those clients for that service. So those were a quick overview on our utilization reports and the three tabs that we have included within these reports. So shifting gears to our settings. So when you first log into PSYCKES, your landing page might be recipient search or my QI reports. If you would like to change your home page, you can come to the settings option and you can select change my home page and you can select any of these options available. So for example, let's say you select recipient search. So when you log into PSYCKES next time, your landing page is going to be recipient search. For example, if you chose My QI report, when you log into PSYCKES, it will land directly on My QI reports page. So if you would like to change your home page, you can simply go to the settings and select Change My Home Page option. And then we also have my user profile updates. And this is something that you will see if you're logging into the Psyches for the first time. But if there has been changes made to this specific profile, you can also select settings and come to the user profile option. And you can select your work's primary setting, your primary role in the organization. You can select up to two settings or program type in which you regularly work. And in this instance, you can also select up to two. And this is an example for care management users. So primary work setting, you can select provider agency, and then for settings and program type, you can select care management. If it's a health home administration user for primary work setting, you can simply select health home administration when you go to change settings option. And when you enable or when you make these changes, especially for care management users and health home administration users, this will give you an option to enter the DOH consent when you are enabling consent in Psyches for a client. So now that we have focused on a lot of different screens that we have in Psyches and how you can look up a client, how you can pull up many different reports, now let's shift gears to accessing the clinical summary of a client and how you can do that in the application. So, client linkage to an agency. So, a client is linked to an agency automatically and manually. So, if a client is automatically linked to the agency, that means the client have had a billed service at the agency within the past 9 months, or they are currently enrolled in the health home or care management agency according to DOH MAP. So that will automatically link the client to your agency. However, if you'd like to manually link the client to an agency, you will need to attest to one of the followings. So, client signed Psyche's consent or DOH Health Home Patient Information Sharing Consent, the BHCC consent, or the client has provided verbal consent, if there was an instance of a clinical emergency, or if a client is currently being served by or transferred to your agency. So these are two ways that a client is linked to your agency. So let's shift gears to level of access to client data. So consent is required to view clients' information in Psyches, and we have different forms of consent and data associated with that consent type. So the first one that we have is our signed Psyches consent. So this will include the Psyches consent, BHCC consent, and DOH Health Home consent. And this will allow you to access all available data, including data with special protections such as SUD, HIV, family planning, genetic testing, and if this consent is in place, you will be able to access all available data for 3 years after the last billed service. Coming down to our verbal consent, if a client has provided verbal consent, it allows access to limited data, so it excludes any information with special protections, and you will only be able to access this information for 9 months. Then coming down to our clinical emergency. So if there was a clinical emergency, it allows you access to all available data, including data with special protection, and you will be able to view this information for 72 hours. After the time frame has passed, the access status will revert back to no access. And then the last one that we have is attestation of service. So clients currently being served by or transferred to your agency. So in this particular instance, it will link client to your agency for recipient search reports, but it will not provide access to the clinical summary. So these are the level of access to client data. So in order to enable access for a client in Psyches, there are multiple different ways you can complete that process. So the first one would be through recipient search. And in this instance, you can enter the client's Medicaid ID, or you can also search using the name and date of birth. And I do wanted to mention that if you are using the name and date of birth field for the first name, at least to characters are required if entered. For last name, full last name is required if entered. And you can also enter the date of birth, and it improves search result when searching with the name. So once you have entered the information, it will show you one recipient found, and it will show the Medicaid ID, and then it will have this column with the name, unique identifiers, race and ethnicity, address, Medicaid managed plan, Medicaid quality flags, planning considerations. And when you come down to this current PHI access column, right now it says no access. So you want to make sure that you select this enable access option right here. And before enabling access, it is important to verify all these important information to make sure that you are enabling consent for the correct client. So when you select enable access, it's going to show you this pop-up window where you can enter appropriate level of access. So you can enter, you can specify if a client has signed PSYCKES consent or the BHCC consent or the DOH consent or any of these other consents. And you can also find detailed information on these specifics if you select this I button that says about access levels. So in this instance, we have selected client signed a PSYCKES consent. So once you select that, it's going to ask you if the information right here is correct before enabling consent. And then for how do you know this is a correct person, you can access to the client's identity, or you can also specify if the client has provided one photo ID or two forms of non-photo ID. And once you have specified that, you have the option to enable consent, and you also have the option to enable and view clinical summary. So if you select this option, you will be enabling consent, and it will also directly take you to the client's clinical summary. So here's an example of PSYCKES consent being entered. So as you can see in the previous screen, the name of the client was not in this blue hyperlink, and coming down to our current PHI access column, it will now say PHI, or it will now say PSYCKES consent. And because the client's information is in this blue hyperlink, you can select this and you can drill into the client's clinical summary. So there's also another way to enable access for a client in PSYCKES, and that would be through our Registrar Manage PHI Access option. So you will come down to Enable PHI Access and select this option, where it will also give you an option to enter the Medicaid ID or name and date of birth. And that is also another way you can access consent in PSYCKES. And we also have the search and withdraw consent, as well as search and deactivate attestation. And these two are the topics that we will be discussing next. So focusing on search and withdraw consent. So for withdrawal of consents, clients have the right to withdraw consent at any given time. So withdraw consent form must be used, and it is available through the PSYCKES application. And when you go to the registrar menu and manage PHI access, we do have a form listed there. And we also have our withdrawal consent form posted on our PSYCKES public website. So after the client signs the withdraw consent form, Manage PHI Access menu must be used to register client's withdrawal of consent. Agency may still have access to client data if client is positive for a quality flag, and agency bills Medicaid for them. And you can also go to the registrar manage PHI access option, where you can have the attestation to service be deactivated. So taking an example, we have our search and withdraw consent right here, search and deactivate attestation right here. We also have our withdrawal consent form available in this module, and you can also download it on our public website. So once you select search and withdraw option, it's going to give you a place to put in the recipient's Medicaid ID, also a place for name, date of birth as well. So once you have the Medicaid ID of the client, and once you click submit, it's going to pull up the information for that client. And when you take a look at the current PHI access column, it will show you the current consent that's in place, and it will also show you an option to withdraw consent. So once you select withdraw consent, it's going to show you this pop-up window where it will say withdraw consent for the specific client, and you can select which active consent to withdraw. So in this instance, we have PSYCKES consent for Main Street Mental Health Clinic, so you can select that option. So when you select that option and you click withdraw, you will get a confirmation that will say consent withdrawn for that specific client. And in order to confirm if consent has been successfully withdrawn, you can you can search the client's Medicaid ID in recipient search. And when it shows you that information, when you go to the current PHI access column, it should say no access, and it will give you an option to enable access. So that is one way to confirm that consent has been successfully withdrawn. So those were some of the examples on how you can enable consent as well as withdraw consent using the Registrar menus Manage PHI Access module. So now let's shift gears to the clinical summary. So we have learned how to search a client in PSYCKES. We have learned how to enable consent in PSYCKES. Now let's talk about some of the information that we have in the clinical summary. So, what exactly is a clinical summary? So, this is a document that summarizes up to 5 years of treatment history for a client, and it creates an integrated view from all databases available through PSYCKES. So, for example, hospitalizations from Medicaid billing, state PC residential services from state PC EMR. We have health home information from DOH MAP, suicide risk from incident management, AOT court orders from OMH database, homelessness information from DHS and Medicaid. And one of the purposes of the clinical summary is to summarize the treatment episodes to support rapid review. And episodes of care are also linked to detailed dates of services if needed, so you are able to drill into a specific diagnosis as well as view the procedure and when that specific procedure occurred. And to increase accessibility, our clinical summary is organized by sections like an EMR, so it's easier to follow through. So here we have our clinical summary section. So we have a section for general information, current care coordination, notifications, active Medicaid restrictions, alerts, SDOH information, quality flags, PSYCKES registries, plans and documents, behavioral health and medical diagnoses, IVOS information, care coordination historical information, medications, and that's divided into controlled, behavioral health and medical, outpatient services, which is divided into behavioral health and medical. We also have information on crisis services, hospital and ER services, dental and vision, living support or residential treatment, laboratory and pathology, radiology, medical equipment, and transportation. So as you can see, we do have quite a lot of information that we have summarized in our clinical summary. So here we have an example of our brief overview of the clinical summary. And at the very top, you will find the client's information and this as of date. And then one thing that I do want to mention is this data sources link. And when you click on this link, it's going to pull up this PDF document where it gives you a detailed information on where the information from PSYCKES is coming from. So, for example, if you go to a specific section of PSYCKES and you're not sure where that information or where that data is coming from, you can always come to this data sources document and find the information listed. So, on the left column, we have all of the data available in PSYCKES and where it comes from. And then the column on the right, it shows specific sections of PSYCKES. So here we have a brief overview of the client's clinical summary, and you also have an option to show or hide data with special protection. And you can also export this document in a PDF format. So this is a one-pager document that summarizes the information. So we have care coordination, notification, alerts, SDOH, any active quality flags, any diagnoses in the past year, and then we come to our full summary. And this is much more of a detailed report. And again, you do have an option to show and hide data with special protection. And I do want to mention this specific section, oops, right here. So this particular section right here, when you have these three horizontal lines, for example, if you're looking for a specific section in Psyches, instead of scrolling all the way to that section, when you come to this particular field and select it, you can just jump to that particular section. So here we have our general information that includes name, date of birth, and address, Medicaid ID, any of the other Medicaid related information, and then coming down to our current care coordination. So this is the most recent information regarding care coordination. We do have a section for notifications. So if a client has a notification for complex needs, it will state that, as well as complex needs due to any specific reasons right here. And we do have a section for high mental health need due to, and then it will also list out the specific reasons and then all the other notifications. And then scrolling towards the middle, we do have a section for alerts. So here we have alert type, number of events, meds, positive screens, the first date, most recent date, provider name, program name. And when you come to this particular section, when you come all the way to the right side of the screen, you can also drill into this specific section to view more information about each alert type. So taking an example of this very first one that says homelessness, NYC DHS shelter, when we select this option right here, it's going to show you these alert incident type, the reporting billing provider, reporting billing program, the date of the incident, any medical classifications, as well as the data source. And as you can see, we have all of these information listed right here as well. And of course, you can export this in a PDF as well as an Excel format. Then coming down to our social determinants of health reported in billing, we have all these information, and you can also click on these hyperlinks to drill into a specific social determinants of health condition. So in this instance, we have the homelessness condition selected, and it's going to show you date of service, service type, service subtype, provider name, as well as any primary, secondary, and quality flag related diagnoses right here. And we do have an option to export this in a PDF and Excel format. And coming down to another section that we have in Psyches, and it's for quality flags. So we have our indicator sets, and we have specific indicators for that indicator set. And the information right now is selected to recent, but you can also change the view depending on the type of view that you'd like to see in Psyches. So for example, taking a look at our graph section, so the graph format provides a visual representation of patterns associated with these quality flags over a specific time frame. So on the vertical axis, you can see all of the quality flags a client is positive for. And then on the horizontal axis, you can see the time frame. And these will give you a visual representation to help with any clinical decision making. So it is certainly a great resource to refer to. We also have a section for behavioral health diagnoses. And again, all of these blue hyperlinks, you are able to drill into it. So taking a look at this schizoaffective disorder, when you select this link, it will also show you the date of service, service type, service subtype, provider name, as well as primary, secondary, and quality flag related diagnoses. And we also have a section for medical diagnoses. So we have the medical diagnoses listed here, and you can also select the blue hyperlink, and it's going to take you to a more detailed information. And going to our care coordination section, and previously we saw that there was a care coordination section all the way at the top of the clinical summary, where that information is the most current one. The information in this particular section is the historical information. So it's going to show you the service type, the provider, the first bill date, the last bill date, as well as number of bills. And again, if you select this button right here, it is going to show you a lot more detailed information. And you can also change that into a graph view if that is a preferred one. And then we do have a section for our medication. So we have controlled substance, behavioral health related medications, as well as medical um, related medications. And when you go to our graph view uh, or click on see details icon, you can also drill in to the specific information and see details regarding pickup dates or the brand and generic name of the drug, as well as the drug class, the strength of the drug, quantity dispensed, dates of supply, pharmacy, and all these other information. So you can always drill into more information right here. And now coming down to our behavioral health services, again, we have our services type, our provider, our first date billed, last date billed, number of visits, the most recent primary diagnoses, and most recent procedures last 3 months. And again, if you drill into a specific service type, you can take a look at information based on diagnoses as well as any practitioner data if applicable. So coming down to our crisis services section, so again, we have crisis services type, the name of the provider right here, the admission slash first build, discharge date or last date build, number of visits slash length of stay, most recent primary diagnoses, most recent procedures, last 3 months. Again, you can always come down to the drill-in information right here to get much more detailed information on a particular crisis services type. And we do have an option to view that information in a graph format if needed as well. And then we also have a section for hospital slash ER services. As mentioned previously, we do have an option for table and graph. And in this instance, this shows the all of the ER services and inpatient hospital services utilized by a client. So you have the service type, the name of the provider, the admissions date, the discharge date or the last date billed, a length of stay, most recent primary diagnoses, as well as procedures per visit. And again, you can come down to our drill in sections right here, and you will have much more details on a specific service type, a specific date of service. So all of that information is located right here. So those are the example of some of the sections that we have in the clinical summary. And as we are nearing the end of this training, I would like to take some time to go over some of our other trainings, as well as details on technical support. So, for our more PSYCKES resources, you can visit our PSYCKES website, which is www.psyches.org. And we do have a dedicated PSYCKES help desk for our application. So if you have any questions regarding PSYCKES, please feel free to reach out to our help desk, which is open from 9 a.m. to 5 p.m., Monday to Friday. And our email is listed right here. So it is psyches-help@omh.ny.gov. And if you're having issues with your token or logging in, you can contact the ITS or OMH help desk. So if you're an OMH employee or a state psychiatric center employee, you can contact ITS help desk, and we have the information right here. But if you are a non-OMH or non-state PC employee, you can contact the OMH help desk, and we have their contact information located right here. So we have their phone number, and if you'd like their email, it is listed right here as well. So that concludes our introductory training on psyches, and now I will open the webinar for any questions and answers that have come in. So, do we have any questions that have come in so far?
Hi, Ashma. Yes, we do have a couple of questions. The first question was a user asking, how can I see which of my staff have enabled PHI access to clinical summaries?
That is a great question. So, in that instance, you can always utilize the usage report option that we have available. And when you select PHI Access module, it will show you a list of users from your organizations that have enabled consent for the client. And if you would like more detailed information, you can also utilize the clinical summaries option located within usage reports. So you can select for a particular recipient by entering their Medicaid ID, and you can also enter the staff member's user ID, and it's going to show you information on when that clinical summary was viewed by the staff member at your organization. So you can certainly utilize the usage reports. And if you do have questions about any particular client, we definitely recommend that you reach out to our help desk. And when sending in um, client identifying information, we do ask that you follow your agency's PHI protocol. And we can certainly take a look at a particular case, and we will be responding to that as well through the help desk.
Thank you, Ashma. That's so helpful. Okay, and then the last question that I had from a user was, I'm interested in seeing which clients I'm serving that are eligible for Health Home Plus and have schizophrenia diagnosis. Is it possible to run that report in Psyches?
You can certainly run that report in Psyche. So there are a couple of different ways you can do that. And the first one is through quality flag sections that we have in our recipient search. So when you go to our quality flag, we do have a flag for um, health home enrollment information. So when you select that flag and complete that cohort search, it's going to give you a list of information on clients that were enrolled in a health home. And you can also change a view of that result depending on any other details that you would like on the health home related information through our advanced views. So you can certainly look up health home related information through our quality flags section in Psyches.
Thank you, Ashma. That's so helpful. All right, I'll pass it over to Melanie in case she got any questions in as well.
Hi, I do have one question that came in, and the user asked, if I work at two different agencies, will I only use one token to access Psyches?
That is a great question, and thank you so much for bringing that up. So, if you have multiple organizations, you will not be using a same token for those. You will need two different tokens in order to be able to access psyches for those organizations. So, we definitely recommend that you reach out to our psyches help desk, and we can send you instructions on gaining access to the token as well as installing it. But to answer your question, you will need two separate tokens if you work at multiple organizations to view that organization's information in Psyches.
Thank you. And then there is one final question, and this is related to the types of consent. And the user is asking, what happens when I activate an attestation of service?
That is a great question. So when you complete the attestation of services option in Psyches, it will link the client in your agency. So they will be able to show up in the aggregate level. So for example, if you look for a specific quality indicator and that client is positive for that specific quality indicator, they will be included in that number that you generate through QI reports or recipient search, so they will be included in that number. However, you will not be able to view their clinical summary since consent is required. So it's just a way for us or for the providers to link a client to the agency, and once consent is gained, they can enter that in and view the clinical summary. But it will link the client to the provider agency, and it will be included in the provider's QI report numbers. So both the information will be available in an aggregate level.
Perfect. Thank you. Those are all the questions.
All right, thank you so much, Michelle and Melanie, and thank you all so much for your questions. And again, if you do have any other questions or require additional support, we highly recommend that you reach out to our PSYCKES help desk. So thank you all again for joining us today's webinar, and we will be sending out these slides and recording shortly. And again, if you have any questions, please feel free to reach out to our PSYCKES help desk. Thank you so much.